In this video, we're going to be talking about facial contouring with dermal fillers. When done correctly, we can make someone look just more youthful, rejuvenated, more attractive, and most importantly, completely natural, where it looks like we haven't done anything. The ultimate success occurs when a patient is complimented about how good they look, but someone really can't tell that anything specifically has been done. So what's the key to a natural looking result? Because that's what everyone really cares about. I want to make sure I look natural. It's an art and it takes years and years of experience. Number one is choosing the right candidate. Sometimes people come in for dermal fillers and they're just not candidates for that. They may need something that tightens the skin, they may need things that improve the quality of the skin and other things, and fillers aren't right for them. Second thing is when we are using dermal fillers, we want to use the correct ones. We have dozens of them now. And because this is our expertise, our focus, we use all of them. And certainly these fillers are better at filling lines, others are better at creating volume, others are better at lifting parts of the face. So using the right tool for the job is essential. The last thing, and really important one, is experience. It takes many, many years, decades actually, to hone this craft. To be able to look at someone and know where to tweak, what to do, and very importantly, what not to do to achieve that natural looking outcome. If it's been done well, very often what we're doing is improving the facial proportions. Proportions are critical to beauty. When we look at a face, there should be pretty much an equal amount of volume in the upper third, to the middle third, to the lower third of the face. And when they're not equal, something just doesn't appear correct. And our eye is drawn, unfortunately, to the wrong area of the face. When we correct those proportions, however, the face looks better, it looks more youthful, looks more attractive. Very often a patient will come in and they're fixated on a given area. They'll say, my lips are too small, or they'll say, my cheeks are too large. The truth of the matter is, the whole area of the lower face is small. And if we listen to what the patient sees and just make the lips bigger, it's not gonna help, and actually it may hurt. So it's very important for us to educate the patient about the totality of the face. The truth of the matter is when we look at others, we look at the face as a whole. And it's very, very important because to understand that what a patient sees in themselves may not be what the rest of the world sees. Lips are a great example. Very often a woman will think their lips are much smaller than they are, especially the upper lip, and that's because they're looking at two dimensions, either in a photograph or in the mirror, where when we look at people, we're looking at three dimensions. When it comes to dermal filler injections or facial contouring, it's very important to take the whole face into account, to look at those facial proportions, to make sure we're making them as close to perfect as we can. And then we look at features. We look at the shape of the eyes. We look at the shape of the nose or the shape of the chin. With Lisa's in great shape. She's very, very pretty. And she lost weight. And in the photo, the before photo, we see she looks a bit drawn. We see a lengthening of the mid part of the face and a flattening or hollowing of the cheeks. We also see, likely due to some stress like we all have now, crinkling in the lower part of the chin and actually shortening of that chin. In the after photo, what we've done is actually increase the volume of the chin. We've increased some of the contours in the mid-face. And if you look at the shape of Lisa's face, we've turned her back into the ideal oval, which is what we want to see. Her face doesn't look as long. She looks like she just went on vacation. She looks rested. She actually looks like she put on a few healthy pounds. And she just looks a better version of herself. So looking at those facial proportions is critical. Creating symmetry is also critical. The next thing to talk about is symmetry, or the two sides of the face. They're not supposed to be identical. So they're not twins, but they're sisters or they're brothers. We can make these sides more symmetrical, and that can help. But very often we don't want to make them exactly the same. There's a reason for asymmetry. For example, if you have someone where one eye is smaller than the other eye, and the cheek is also smaller, if we made that cheek bigger, that eye would actually look even smaller. So we have to take differences into account when we're deciding whether we want to make things more symmetrical or identical. The next thing we look at are features. The features are things we attend to after we attend to the proportions and symmetry. So features may be the size of the lips, they may be creases in the nasolabial folds, they may be dimples in the chin, and that's like the icing on the cake. Very often patients will come in for treatments for that icing on the cake, and we try to explain to them it's really important to deal with the foundation of the face first. If we're building a house, would we start with wallpaper and sheetrock? No, we'd start with foundation. Once we have that foundation the way we want it, it's much easier and much more fruitful, and much more economical to then apply the exterior finishings to the face. People have this misconception that the amount of filler is what determines an unnatural look. And the truth of the matter is, you can have one syringe of filler done the wrong way, create an unnatural look, or I can use a dozen syringes of filler and you won't even be able to tell where they went. Someone will just look more natural and more youthful. So where we put those fillers, how deep they go, the manner in which they're injected, which fillers we use, the layering of fillers that we do. There's so many factors that go into achieving that natural look. But the amount of filler really isn't that factor most of the time. Each syringe of filler is 1 cc, which is 20% of a teaspoon. So in a given person, if we're using 5 or even 8 syringes of filler, that may be a teaspoon or a teaspoon and a half of volume. Well, injected correctly, that can make an incredible change in someone's image. When they feel better about themselves, they act differently. They're nicer, they look for difference in jobs, they look for new spouses, they treat others better, and most importantly, they treat themselves better. They're kinder to themselves. So these injectable agents can make huge impacts in someone's emotions, and that's the most fun part about it for me.